welcome everybody. Super excited to be here for the Ophthalmology quarterly release party. My name is Gregor Backus. I'm the Director of Ophthalmology Sales. And Ryan, you want to go ahead and introduce yourself?
Hey everyone, this is Ryan. I'm the Senior Sales Engineer here at Nextech.
Awesome. Well, we got a couple of things we're going to go over today, but let's just go ahead and get started with a quick poll. So those of you who've never joined these before, we always like to know what's the purpose of joining today's demonstration. So why are you attending this webinar? So are you looking at possible other software solutions? Are you curious about what we're up to or other? So we'll just go ahead and give it a couple minutes or 30 seconds. Awesome. Just waiting on those results to come in. We'll advance over to the next slide. Okay, so it's pretty even, actually, right across the board. So that's kind of exciting to see. So who are we? Who is Nextech? And what do we do, right? So 6,000 eye care providers on the platform, about a third of the market share, which equates to over 60,000 users and over 1,000 practices throughout the country with over 26 years of experience. We throw a couple of bigger groups, if you will, throughout the country, some household names, if you will. Just always like to throw that up there in case there's somebody that you kind of familiar with. But again, anybody attending this webinar, if you want to talk to anybody in your local area, please feel free to reach out. We'll always set you up at a reference. Next slide, please. Awesome. So we can just go ahead and advance the whole slide. So Nextech truly does define innovation. We really look at this in 4 pillars. So we're looking at simplicity, charting innovation, which will actually show some cool things that we're working on today, our unmatched support and service, and then patient experience. So as consumerization is becoming more and more things that we're seeing in the ophthalmology space, there's no better time than the present to make sure all of your patients are having the very best experience they can in your office. We talked a lot about this at our latest Edge conference, and we'll talk a little bit more about this as well coming up. But let's go ahead and do one other poll. And this is always just kind of fun to kind of check the audience. What is the biggest headache with staff productivity today? Is it things like claims need to be coded and billed faster with less denials? Are we collecting patient information from other external systems? Or is it dealing with patient no-shows? All 3 of which could definitely increase a headache in practice. So we'll give 30 seconds or so on that. Awesome. And let's go ahead and advance the slide here so I get those results. Just go back to one screen for the results. Sorry, missed that. Oh, got it. Perfect. So dealing with patient no-shows would seem to be the main one that's the biggest headache in staff productivity, which is kind of unique because one of the things that we're going to be talking about in this next slide actually addresses that. So what's been new with going on with Nextech? Oftentimes we get calls is how do we do more with less? Obviously, staffing is a big issue all around the country. So some of the 3 things that we've worked on is optimize billing accuracy. So kind of how do we make the claim as clean as possible? So we've extended our assisting coding tool into E&M codes. So we've always had it for I-codes, but now we introduced it for E&M, which Ryan is actually going to give us a preview of what that looks like. We've also reduced the no-show with the ability to send multiple email reminders. And you can do that directly into our practice management, which we'll also show. And then the third one, I'm actually going to hand it over to Ryan. Ryan, you want to talk a little bit about Nextech's health information exchange integration that is coming out?
Yeah, absolutely. So within our health information exchange information, we actually are tied directly into Patient 360. Which will, of course, allow us to view patient records, documents, all easily uploaded directly from Nextech EHR into Patient 360. And we actually have a brief video to review on this tight integration that we have here at Nextech. Now, through the chart record, we'll have a single sign-on solution. With that single click, we'll jump right into Patient 360. You'll notice you have your patient information automatically uploaded. Once that chart record is signed, a PDF of the record and your CCDA is automatically provided on Patient 360. Any other organizations that's currently using Patient 360 will automatically provide you all the documentations and records should you choose to. And lastly, on the left-hand side, you'll notice these modules allow you to jump and easily access patient information, medications, labs, or any images directly on that middle of the screen. Now, let's go ahead and tackle this last and final poll question for today. What is the one thing you wish you can do to increase your speed to revenue? Now, is it quickly schedule multiple appointments at once? Is it to reduce the common denials? Or last, increase collections and patient satisfaction by accepting more payment methods? We'll give you guys a few seconds here to log your results.
All great questions.
Yeah, yeah, absolutely. Now, this is a good tie-in to how we can increase speed to revenue here at Nextech. Not just a few items to tackle. Of course, one of the things that's often overlooked is how to quickly schedule multiple patients' appointments, such as appointment bundling. Of course, naturally, what we would love to do is to efficiently manage these bundled appointments in a flash. Next on over, what we absolutely love to do is to empower our staff to catch these costly errors before the claims are sent. And you can absolutely accomplish that within our custom claim edits. Last but not least, well, let's increase these collections and patient satisfactions, right? We actually have a pay by link. You can do so via SMS or even by email with each of your patients independently. So with that, let's have a quick look at that within our software. Now, one of the first items that we've tackled a little bit early on, Greg shared on his end, and that's the E&M coding here at Nextech EHR. Now, towards the tail end of the examination, let's go ahead and pop open this coding. This dropdown does present your I and your E&M codes. Now, we're going to focus on these E&M codes as we are targeting these items, and we're providing you a red icon. These icons are illustrating that we are missing some additional documentation in order to meet that level code. Now, our software does an excellent job at breaking down exactly what's required. We'll indicate which measurements we've actually passed and completed and which ones we have yet, as we don't have those green checkboxes. Now, the software will even indicate what's exactly required. At least one self-limited or minor problem must be captured. Let's go ahead and attach a status, maybe for nuclear sclerosis. Maybe it's chronic. You'll notice that green checkbox will now update for us. Let's go ahead and close out of this coding grid for just a moment so that we can all be aware that we've now met that actual measurement to now submit that claim into the billing side of things. Now,
this is a tremendous feature, by the way, Ryan. Sorry, I just want to jump in there.
Yeah.
The about this is as things change in the space, right? Whether it's new changes to codes or things that are payable and no longer payable, and so forth and so on, we are made aware of these changes and will automatically push these updates. So it really does take a lot of that guesswork out of some of the complications that coincide with E&M and I codes as well. Sorry, I just wanted to add that in there.
No, it's super helpful there. Now, that's over on the clinic end. Let's go ahead and pop back into the practice management side of things. Now, we all know we have those patients, sometime or another, they just won't show up. And what's the easiest way of contacting each of those patients? Now, within the software, within our check-in, check-out center, let's go ahead and mark this patient as a no-show. What the software will do for you is automatically notify that patient the second we drop them into that no-show bucket. Now, based on that patient's preferences, they can either receive a phone call or text or email, but upon receiving of which, the patient has up to 48 hours to respond. And by responding, we're hoping that they're rescheduling their appointment. Now, let's say they haven't responded yet. At that 48 marker period, we will send a follow-up notification directly to that patient. Now, let's say within that patient, we're we're looking to bundle appointments. Maybe we're scheduling this patient for 2 types of visits. Lower left corner, let's go ahead and add a linked appointment. And for this patient in particular, let's say we're scheduling an established patient visit. And maybe they're also coming in for a visual field. For those of us that work in clinic, we understand that those visual fields take up a ton of time, so we have to schedule appropriately. Now, the top right corner, we'll hit search, and with a side-by-side, you have the capability to search and book multiple appointments for each of your patients. On the left-hand side, we can track that physician. Maybe let's go with Dr. Kyle. And as we mark this little down arrow key, we'll have each available appointment provided for us that we can select on. And maybe for the visual field content, we'd like that side-by-side comparison too. So we can easily document or schedule that patient for a 1:15 appointment and maybe 4 p.m. Top right corner, confirm these selections and book. Very easy for our patient flows.
Appointment bundling is one of those things that is not often seen in a lot of different softwares. And I truly think that this really plays an important role in eye care. As we all know, oftentimes a patient may need 2 appointments, whether, like Ryan mentioned, a visual field and an actual encounter. Maybe it's a laser and an actual exam. So this is one simple screen to see all this, and it really does minimize the amount of effort it would take to try and make 2 appointments in a traditional setup. So very cool stuff.
Absolutely, absolutely. Now, again, we all know while working in clinic, sometimes doctors or assistants might not bill appropriately, or maybe there's some rules that they're not fully aware of, but our billing staff are very well equipped. So let's make sure that we're all on the same page here. We'll have custom claim edits available. Towards the top left corner, there are multiple rules that we can designate them to, whether it be your diagnosis code mismatch, your modifier mismatches, any global periods, which is often overlooked as well, or honestly, suspicious diagnosis codes. I don't really know how we can handle this, but in our software, we absolutely can assist our physicians, our billing staff, everyone universally. Easily. Towards the middle of the screen, we'll add those codes. Here's a few examples provided just below. Next on over, if there's any plans to be associated to each of these codes, we can certainly add or move on to the next step, diagnoses. Let's attach certain or several codes, diagnosis codes, to each of those CPT codes. And finally, within the rules and warnings, we do want a pop-up notification for our billing staff to be made aware. Once this is triggered, they'll automatically receive this notice so they can make those adjustments on the fly. Over on the right-hand side, simply save and move on. Last but not least, let's go ahead and collect these payments for our patients, right? Towards the middle of the page, we'll have a send payment link. Now, within this pop-up window, we can capture each of these drop-down filters. So we want to designate our practice, the amounts that we want the patient to pay through, locations, and so on. You can even attach a customized note for that patient. And then lastly, you can email or text the patient. Lower right corner, go ahead and hit send. They'll receive it right then and there. Now, Greg, I'll just go ahead and hand this on over to you.
Oh, yeah, sure. If you want to proceed to the slide, please. There you go. Sorry there. Well, awesome. That was very cool stuff that we have going on there. I know a lot of those functionalities and features, there's some things that we've been working on for some time, stress tested it with our current clients as well to make sure that it will solve the needs for most of the people that are requiring that kind of functionality. Now for some kind of fun stuff. So artificial intelligence. You probably get 2 calls a week, whether it's a customer or a potential prospect asking about AI. What does it mean? And will Nextech be adopting AI? Nextech does truly feel AI is the future. It is something that we have been doing a lot of due diligence on over quite some time. And for those of you lucky enough to be at EDGE, which no one probably on this call, but our user conference that happens usually every year in February and March is a big user conference where everybody gets together and they can see the things that we've worked on and some of the new things coming up. We had an innovation lab, which was very cool. You can actually see some of this stuff in real time. But we've been really looking at the best way to utilize AI across all of our products. Our main kind of focus initially is going to be really in kind of the three verticals here, which is being able to handle routine conversations with your patients. So some exciting stuff coming on that side of things. One of the things I'm most excited about is being able to complete the entire charting experience via an AI scribe. That was one of the things that we actually showed in real time with our Chief Medical Officer, Dr. Hanza. And the third thing, which again is support when you need it most. So being able to immediately access support resources, potentially directly inside the chart in real time. All three really exciting functionality that we are going to be working on, and then hopefully within very soon we'll be able to actually demo this type of technology on a session like this coming soon. So I always like to look at, it's easy for everybody to say we're more efficient, we're less clicks, but the proof is in the pudding nonetheless, right? So here's 4 case studies that really highlight each pillar that I discussed in the beginning: simplicity, charting innovation, unmatched support, or a patient experience. One of the ones I always like to point out is Dr. Salve Vision is actually spending less than 2 minutes on the entire charting process. I can get into each one of these, but we'll be on this call for another hour and be going over all these case studies. So for any of these you're interested in, obviously reach out. We're more than happy to share this. I believe all of these resources are also available on our website, so you can read these case studies to kind of see these are most applicable to you. So in closing, Nextech's mission is really simple. We're trying to make things as efficient as possible, try and get you paid as quickly as possible, and being able to offer the best patient-centric care that you can, whether that's patients being able to book an appointment online immediately or do something as simple as pay their bill via text or email. So with that being said, I appreciate everybody who joined up here. We're going to open it up to some questions. We'll give it a minute here. If anybody has any questions, we'll go ahead and type those in. Awesome. Oh, looks like we got one here. Ryan, this one will be for you. What kind of rules am I allowed to create in your practice management system?
Yeah, certainly. So there's quite a few rules that we can designate within the software itself. Obviously, coding can exist in multiple different realms. So one in particular is the diagnosis code mismatch, followed by modifier mismatches. The global periods are a sensitive subject there, as well as any suspicious diagnosis codes.
Looks like we got 2 more here. So if anybody has anything else they want to throw in, go in, but I'll read these last 2. Does it require extra work to share information from your EHR into the Nextech Health Information Exchange? So that's the HIE, Ryan. Did you want to add some clarity into that?
Yeah, absolutely. So our integration is incredibly tight. So by that, what I mean, once your physicians sign off those chart records, our HIE, the Health Information Exchange, will automatically import the patient's PDF chart notes, as well as the continued care documents, so your CCDs, automatically shared over to Patients 360.
I mean, if there are any practices that are on here that would have a relationship with any hospitals or education systems that participate in the HIE, I think that's a tremendous leap forward in trying to put everybody together all on one electronic health record system, which I think was the original intent of all of this many years.
Yeah, absolutely.
As far as the last question is more of a compliance question, I think it's a fair question to ask. Is there a time limit that can be sent for payment links for patients? That's obviously in regard to the payment via text or email that just came out.
Yeah, that's actually a really smart question, and absolutely compliance as well. So we strict and adhere to compliance here at Nextech. So the payment link is only valid for 24 hours, but it does not mean that you can't resend another link to the patient. So you absolutely can.
Awesome. Well, I think that's it question-wise. Ryan, tremendous job as always. I really appreciate you taking the time to show us these demos here. And of course, if anybody else has any questions, want to see an actual demonstration, please feel free to reach out. We're always happy to set that up. And again, I appreciate everybody's time here and look forward to doing this next time. Everybody have a great early weekend. Thanks, guys.
Absolutely. Have a great one.